This is my genogram. This is my family pedigree. Here I am listed in blue. My brother, brother-in-law, my sister. This is my first niece, my 3 cousins, our family, and then our grandparents here. As you can see, it's not a very big family. There's only 1 deceased, no adopted, a few relatives here that are not related by marriage. So, among my siblings and my cousins, my cousin Kristen, my paternal cousin, was just diagnosed with gastroparesis. Otherwise, the rest of us, no medical history. On my mother's side, she has had skin biopsies, but no diagnoses of any illness or disease. My father's side, he takes medication for his cholesterol, and they're both 55 years old. My father's parents' side, my paternal grandmother here, Joan, was diagnosed with breast cancer at age 80. She is still alive. She has also been diagnosed with hypertension at 65. My paternal grandfather is diagnosed with skin cancer at 80, type 2 diabetes at 50, and high cholesterol at 50. My father's siblings do not have any past medical history worth mentioning that I know of. Now, my mother's side. My maternal grandmother passed away a few years ago, 73, from complications of small bowel obstruction. At that time, she had Alzheimer's and dementia for the past few years. She also has had non-Hodgkin's lymphoma at age 60, broke her arm twice, diagnosed with osteoporosis, had several spine surgeries. My maternal grandfather, he has had a history of atrial fibrillation, has had an ablation, and is on Coumadin as well as beta blocker. But besides that, he's very healthy. He's active, plays golf every day, and he's 85. My mother's brother is overweight, so he has to take blood pressure medication as well as cholesterol medication. This is related to his activity level. My grandmother had a very poor diet, did not take care of her bones, and used Benadryl very often. Again, maternal grandfather, pretty healthy. He did have a history of smoking when he was in his 20s and 30s, as well as my father, 20s and 30s. But they have not had any cardiopulmonary disease. Thankfully, as you can see throughout my slides, the only history that I'm worried about, diabetes, cancer, hypertension, high cholesterol, heart pain, dementia, Alzheimer's. But I associate these diseases, more towards diet, activity, environment, drug practices, because these things we can modify. Now, this is one of my favorite sayings: failing to prepare is preparing to fail. Preventing disease and recognizing the risk factors associated with a client's health is the beginning, is crucial. So this is John Wooden's quote, one of my favorite famous sports coaches. And then here's some possible indications, again, for the client, myself. There, test for breast cancer, possible chance, because my grandma has a history of breast cancer. Watching cholesterol, blood pressure, and then for diabetes. I've had a biopsy done for moles as well as a breast ultrasound, but thankfully so far ruled out all complications. Here are my references. There's several textbooks, John Wooden, the Memorial Sloan Kettering Cancer Center, National Institute of Health, of course, World Health Organization. Thank you again for viewing my slide.